I am Dr. Anand Babu, consultant orthopedic surgeon at Care Hospital, Mushirabad. Today I will discuss about bone tumors. Bone tumors can be non-dangerous and dangerous. So non-dangerous tumors are called technically called as benign tumors, and dangerous tumors are called sarcomas or cancerous tumors. In non-dangerous tumor category, usually they don't spread to other parts of the body. In dangerous tumors, they spread to other parts of the body like lungs or other areas of the bone or anywhere else in the body. So that's why they are called dangerous tumors or cancerous tumors. So bone tumors usually present with pain, swelling, and sometimes the first presentation will be a fracture with pain sometimes, because the bone tumors eat away the bone and weaken the bone, and the fractures are more common with trivial trauma. And sometimes bone tumors can cause fever, night sweats, these kind of symptoms. Usually bone tumors are diagnosed with an X-ray, basic X-ray, and sometimes if it is a small tumor, you may miss an X-ray, so you need some advanced investigations like a CT scan or MRI scan to detect the smaller bone tumors and to plan for the treatment. So nowadays, because of the advances in the surgical technique, the benign tumors are usually, if some of the benign tumors, non-dangerous tumors, are you just observe them whether they are growing more with periodic checkups on the patients once in 3 months or 6 months like that. And some tumors you remove them entirely like a resection, and patient will be cured. And sometimes some tumors you just do a radiofrequency ablation. That is also possible in case of osteoid osteoma like tumors, where pain goes away with radiofrequency ablation, where the radiologist will introduce the radiofrequency probe into the bone tumor, and he will just boil the tissue of the tumor with the radiofrequency probe. And some of the tumors are non-dangerous tumors are little bit more aggressive, like a giant cell tumor of the bone. So they need a treatment like surgery, where you remove the bone affected tumor and put some bone graft or bone cement in the place of removed bone area. And coming to the dangerous tumors or the cancerous tumors called sarcomas, usually the treatment is surgical resection most of the times, and it is combined with radiotherapy, that is X-rays given in a higher dose. Radiation means X-rays given in a higher dose, and chemotherapy, the drugs to kill the tumor cells. In other words, these are the 3 treatments employed basically. In surgical treatment, the newest modalities are you remove the bone, affected bone, and with a surrounding margin of normal tissue, and place a bone graft from somewhere else in the body, or from a donor bone, or you can keep a metal implant, like if the tumor is near to the joint, just like a joint replacement, you put a mega knee replacement or mega hip replacement kind of processes, artificial processes in the place of the removed bone, and thereby you spare the limb. So previous days amputation is the only answer, where they used to remove that part of diseased leg or hand. They used to do amputation. Nowadays this new trend of limb sparing surgery or has come because of the advances in the treatment like chemotherapy and radiation therapy. So these things are the standard of care in the cancerous tumors of the bone, and if the patient is detected early, that is before the cancerous tumor spreads to the other parts of the body, if the patient comes, then the patient can benefit with this advanced technology like chemotherapy, radiation therapy, and the limb sparing surgery, where you preserve the limb and without amputating the limb. Please consult specialists at Care Hospital, Mushirabad for further information on bone tumor treatment.